Hey guys, has been a while since we had this lecture, so I'm gonna make a quick review here. Hopefully, it helps you with reviewing the material for the exam. This is the sleep and sleep disorders, and we agreed together that what defines sleep is a temporary or reversible state of decreased awareness of the environment and the environmental stimuli surrounding you. We will talk in a little bit about the importance of sleep, but what characterizes the sleep is transient loss of consciousness. There is sleep paralysis, and we will speak specifically about that when it comes to the rapid eye movement stage. But generally, there is less loss of tone, loss of movement. And when it comes to stage, the rapid eye movement or the paradoxical stage, there is what we call sleep paralysis, and we'll talk a little bit about that. What distinguishes sleep from coma is the fact that a stimulus is able to bring you back because it will activate the reticular activation system, which you are aware of as part of the central nervous system. And that will send stimuli through the thalamus into the cerebral cortex, and that will wake you up to tell you it's daytime or time to wake up. And those stimuli can be visual, can be touch, can be other sensory, it can be light. So all of these things will, of course, have an impact, and we all have experienced that. When someone puts on the light or put on music or call your name or touches your hand, and then you'll wake up. And that, of course, distinguishes sleep from something deeper like coma. Okay, so somehow my mouse is acting up, and I'm not sure why I'm not able to flip the slides the way I want. So anyhow, sleep has restorative function. The brain glycogen, the storage, ATP, all of that will be replenished. We will learn when we get to the endocrine system that there are certain hormones that will be active during night, like growth hormone, for example. There are other hormones that are active during the day, so your body has to distinguish between day and night. You start to synthesize things during night. But it's not only physical. We kind of discussed this during the lecture, that memory is also consolidated during sleep. It's a time when making judgment, and I gave you some examples of mathematicians who were not able to solve a certain problem, and then when they sleep on it, then they can wake up in the middle of the night, or the first thing they do in the morning is to grab a piece of paper and write down the answer. The same thing happens with musicians, that they're able to come with the right note during sleep. And why is that? We don't necessarily know, but it seems like during sleep there is no inhibition of the surrounding, because we know that the thoughts during the time you're awake are inhibited by certain factors, even by the reticular activation system, which may tell you, no, you're not good in this, or no, this is not the right note, no, you're going too far. During sleep, you have sort of uninhibited imagination, and the decision can be made far better. Memory consolidated, as we said earlier, and decision, and washing off all the trash that you have accumulated during the day, and the transient memory that gets washed off during sleep, and what remains is in the mind or in the brain are the events that your brain would consider them important, are the events that you want to remember, or your brain wants to remember. It doesn't necessarily mean you consciously wanted to remember. We kind of talked about that. So synapses are enforced during sleep, among other things, among other functions that we discussed together during lecture, particularly in the rapid eye movement, which is the most common stage for dreams, and we'll talk a little bit more about the rapid eye movement when we get to it. So with this introduction, there are two types of sleep. There is the orthodox sleep. That means you're laying down, you're not moving, your eyes are not moving, you're not breathing heavier. This is what defines sleep. You're sleeping like a baby, they say. But then there is the paradoxical sleep, where your heart will accelerate and your eyes will move very rapidly. Everything else is paralyzed, but those two are kind of paradoxical. So that's why we call that particular stage the paradoxical stage. Also, if you look at the EEG waves, which we are going to get to in the next slides, you will realize that the activity of the EEG is resembling a lot kind of an awakening or stage 1 activity, kind of theta waves, a mix between theta and beta waves. So you will see that in a little bit, that there is heightened activity of the brain, and there is heightened activity of the eyes and the heart and the parasympathetic system. We'll talk about this in a little bit, but that's what defines orthodox and paradoxical. Orthodox is the non-rapid eye movement. The paradoxical, from the name, it's a paradox. That means two things that are not matching. You're deep asleep, but however something else is not matching the criteria. The rapid eye movement and the acceleration of the heart and the EEG is not exactly of the sleep pattern. This is what I'm telling you about with the EEG, and they use that, as we talked about, in the central nervous system, not only to diagnose sleep and sleep disorders, but also to diagnose problems with the central nervous system, with the brain, epileptic attacks, and other issues that EEG can hint to. It's not going to tell you exactly where, although sometimes you may guess which lobe, but it will give you some certain activity or activity pattern that can, if for the eyes of an expert, can diagnose problems. And so it starts when you're awake and your eyes are open, and you will get these waves, and it's called beta waves. And if you close your eyes but still you are awake, you get more rapid waves and a little bit of a higher amplitude waves. And we call these the alpha waves. So alpha if your eyes are closed but you're awake, and beta if your eyes are open but you're also awake. When you drift to sleep, the waves start to be a little bit slower, as you can see, and it's 3 or 7 per second that you are getting the waves, and so it's fairly slower waves than what you see in the alpha or even the beta. And every now and then you will get these vertex waves, which are a little bit of a higher amplitude, as you can see here in this picture. What characterizes stage 1, as we know, there is a sense of drift and sense of your muscles suddenly relax, and sometimes it feels like we're falling off the bed when we are in stage 1. And you continue to drift, and slowly you get into stage 2. And in stage 2, again, you will continue with those theta waves. But in between the theta waves, you will get what we call the K complexes. And as you can see here, which are sudden activity and a little bit of elevated amplitude, but they are slightly different than the vertex in the fact that they are of slower frequency, of less frequency than what we see here in the vertex. We'll also see some spindles, which are higher frequency waves that are following each other. The sleep spindles and the K complexes are very common in stage 2. Stage 2, what of the non-rapid eye movement. 1, 2, 3, and 4 are the non-rapid eye movement. Then you get to stage 3, and you start to see here how the waves 3 and 4 Those are both of them together. You will start to see here how what we call the slow wave sleep, that the waves are far apart from each other and they're very slow, 1 to 4 per second, but the amplitude is fairly high, and that is characteristic for stage 3 and 4. Now when you get to the rapid eye movement, you will realize that it's highly similar to theta, or stage 1, what you see here. And so that's why it's paradoxical. You're deep asleep, but then your brain activity is resembling a lot stage 1. We'll talk more about those stages in the next few slides and what characterizes them, but this is the EEG reading. So when we get to the particular stages, you can imagine how the EEG readings looked like. Okay. With those 5 stages, so we agree there is non-rapid eye movement, 1, 2, 3, 4, and then rapid eye movement. And during sleep, you start to get from one stage to the other. You don't necessarily have to go through every single stage. So over here, you're awake, and then you get into stage 1, stage 2, stage 3, stage 4, and that's the period, the time here you're spending in. And then you're getting back to stage 2, and then you're getting to the rapid eye movement, which is the dark line here. And so you can go back to 2 and then rapid eye movement, and from the rapid eye movement you don't have to go to 1, you can go straight to 2, or you can go to 1 and then from 1 to 2, so it varies. And sometimes you wake up in the middle of the night. And so anyways, what this graph is trying to tell us, and that during 7 or 8 hours of sleep, you're gonna keep drifting from one stage to another, from the non-rapid eye movement to the rapid eye movement. What you notice here is that the rapid eye movement stage, which is the dark line, is getting longer and longer and longer until you wake up on your own. The rapid eye movement stage is the stage where you can wake up on your own, but it's not the easiest stage to wake up with an external stimulus. And so, but anyhow, the rapid eye movement, as you can see, is increasing throughout night and until you finally awake after 7 or 8 hours or so. Okay, I'm gonna skip through this. I'm just gonna go straight into, because that's a summary of the sleep stages. And so stage 1, you feel drowsy, you drift, and you begin to relax. Sometimes the relaxation is a little bit too much. You feel your limbs are falling off the bed. The alpha waves are dominating, and then they will be interrupted by some theta waves. And as I told you also, that there will be some vertex complexes that is characteristic of stage 1. In stage 2, you will pass into light sleep. Your EEG, the frequency will decline, and now we have real theta. It's not a mixture of alpha and theta. It's pure theta. And between the theta, you will get something called K complexes and sleep spindles. The sleep spindles are very sharp, very high frequency, and the K complexes, they are low frequency but high amplitude. And that arises from the reticular fibers. The K complexes are arising from the reticular fibers in the thalamus, and also the areas in the cerebral cortex will react to the activation from the reticular network of the thalamus. You will start to get into the slow wave sleep, and we define the slow wave sleep to be stage 3 and stage 4 non-rapid eye movement. The waves will become very slow and high amplitude. There are no delta or there are no theta waves, but those waves, we will call them the delta waves. Sorry. It varies, never mind the 20 minutes, it varies in time how far it is from stage 1. Typically, when you start sleeping, it will be about 20 minutes from stage 1. Muscles relax, vital signs will fall, temperature, blood pressure, heart, respiratory rate, all of that will start to slow down. That's why we call these stages the orthodox sleep, because everything fits the criteria, right? And so we get to stage 4, it still is slow wave sleep. EEG now is dominated by those delta. Muscles are very relaxed, and the vital signs also are at the lowest. Okay. Now we get into the paradoxical stage, which is the rapid eye movement stage, and in which the eyes are moving fast back and forth, and in essence you will be watching your own life runs in front of you. Your brain is reviewing everything, and sometimes events that never happened, it's just a dream, but you are following these events, and some people think that they never dream, but you dream, you don't remember that you dreamt. If you don't dream at all, that's a problem. But your eyes will move, and that is characteristic, of course, of that paradoxical stage. EEG is resembling very much the awakening stage, and that again adds to the paradoxical phenomena. It's very hard to be aroused from external stimulus in this stage, but it's not hard to wake up on your own, and sometimes the dream will wake you up. The heart rate, interestingly, will increase in the paradoxical sleep, and arrhythmia are very common, and so heart attacks, if someone will die from a heart attack, then the most common time, of course, if the heart has a problem, is to occur here at the rapid eye movement stage because of the arrhythmia. Respiration intensifies, and as I said earlier, your eyes are moving fast. Dreams are common in the rapid eye movement and in the non-rapid eye movement, but in the rapid eye movement they're way longer and they're very vivid. In the rapid eye movement stage there is activation of the sensory system. However, like the visual, if you scan the area and the visual cortex in the occipital lobe, you will see it's shining because you're essentially reading and watching your thoughts and your dreams. But there is inhibition of the motor function because you don't want to act those dreams. If you see a car coming towards you, you don't want to start jumping off bed. And sometimes we experience that we feel that we were chased by something, by danger, and we were stuck in cement and our feet are not moving and we are paralyzed, and that's pretty much what you have. You have a thought and you can't act that thought, which is really protective for you. You don't want to act your dreams while you're sleeping or jump off the window because you dream you're evading danger or whatnot. Rapid eye movement will involve also dissociation from the frontal cortex, and the frontal cortex is the place where it performs the logical suppression, the thoughts that tells you, no, you can't think this way. So sometimes we have dream that is really bizarre, and it's like, what was I thinking? And if you remember it in the morning, or if you remember it as you wake up, but that's because the personality is different during sleep. You don't have the normal suppression that you will have from the frontal cortex or from the reticular activation system, which is good. It's great for your creativity. It's great for the thoughts and the consolidation of the memory. But the logic is kind of suppressed. A parasympathetic will be activated, and that will cause constriction of the pupil. We know from studying the physiology of the eye that the constrictor pupillae are supplied by parasympathetic nervous system. Erection of the penis and clitoris in female, it's also a parasympathetic response which happens during the rapid eye movement. So as I told you before, you keep shifting during sleep between the stages, and you don't necessarily go 1, 2, 3, 4 rapid, 1, 2, 3, 4 rapid. You can alternate. What you notice, however, once again here is that the rapid eye movement stage is getting longer and longer and longer, and then we get into the awakening stage after the rapid eye movement on your own. Things change with age. If we look here at the total hours that we sleep, you see as infants we used to sleep around 10 hours. And as we grow into adulthood, then you are in the 7 or 8 hours range. And then with age, the total hours are being reduced as total sleep, not the rapid eye movement yet. Here is the rapid eye movement. Also, it declines a lot in early age, like 5, 8 years old, it will decline. And that's great, because we agreed together that the rapid eye movement was important for the building of the personality, the creativity, and all of these things, and the skills that the child will need, and those will be happening here in the rapid eye movement stage. And then at 20, between 20 and 60, 70, you see that it's more or less approximately 25-27% of your sleep, not 30% as in little infants. You get after the 70, and the rapid eye movement stage is also declined, and that can explain that the older people will be tired in the morning. They feel they're not rested. Even stage 4 will be reduced, and that means that they're easily awakened by anything. They have heightened sensitivity to anything, and you see that with your grandparents, that anything happens in the house can wake them up, whereas between 20 and 50, not as much. Anyhow, so what does that tell us is that the total hours of sleep will decline with age, the percentage of the rapid eye movement will decline with age, but also the percentage of stage 4 of the non-rapid eye movement will also decline with age. And so certain characteristics about sleep, that you lose the regulation somehow of the temperature. There is hypothermia in 3 and 4. And that's when you start to would like to have the covers, and you want to pull on the covers, and you feel cold. And in rapid eye movement, you lose the ability to regulate the temperature, so you're sweating and you feel hot, and sometimes you kick the blanket. It doesn't happen all the time, but there is a loss of regulation of the temperature that happens in the rapid eye movement stage, and that's accompanied by hypothermia that happens in stage 3 and 4 of the non-rapid eye movement stage. So how do we wake up? Well, either stimuli from within, and the stimuli from within will be the reticular formation, and we had some examples about the locus coeruleus and other loci in your brainstem, and the reticular formation in the cerebral cortex. But it can be also from external stimuli, like a visual stimulus, auditory stimulus, or somatosensory stimulus. All of this can bring you up. Sleep, as we know, is controlled by the circadian rhythm, and controlled by some center in our brain. It's called the suprachiasmatic nucleus. And it's above the optic chiasma, that's in the hypothalamus, and that controls your rhythm. And we will get back into the suprachiasmatic nucleus when we are studying the circadian rhythm of hormones. Melatonin, which is produced by the pineal gland, has also a role in regulating the suprachiasmatic nucleus. And we all know that when we have sleep, light insomnia, particularly because of traveling, or the people who are doing night shifts and now they're doing day shifts, and they alternate, and the brain kind of loses which one is day and which one is night. And melatonin definitely helped to regulate the circadian rhythm back into normal. Okay. As I said earlier, the sleep has a restorative effect to the brain. Now we know that the sleep deprivation can affect health very dramatically, even the immune system. And we all know that when you don't sleep for a few days, then you start to have some zits and acne, and get really bad cold, and herpes can start to flare, oral herpes. But the restorative will be the rapid eye movement stage, but that's the mental one. But the physical one will be the non-rapid eye movement 3 and 4. And you're restoring the glycogen, as we said earlier. You're restoring the ATP. The rapid eye movement, like we said earlier, it will consolidate and strengthen the memory, enforces the synapses, washes off the things that you don't want to remember. And we compare that in the lecture to having a washing machine, you're tumbling the clothes in the washing machine, and the stains that you don't want to stick to the clothes will be out, and the very strong stains will be stuck to the clothes. And that's pretty much what happens in the brain. There will be waves and waves of electrical potentials going back and forth and back and forth, and washing off all the things that you try to remember during the day, but they're not very important, and allow you to forget those, but allows also the creativity, allows, as I told you, gave you example about the musical pieces and about the mathematical problems that people can have the ability to solve during sleep. Okay, we did talk about the reticular formation, so I'm not going to spend a lot of time here. I just want you to realize that the reticular activation system, which is the thalamus, and the midbrain are a very pivotal part of them, can receive also information from outside, somatosensory, auditory, and visual input, and all of that can send a signal to the cerebral cortex, tell you, okay, it's time to wake up. Lack of the reticular activation system, of course, or the signaling of the thalamus, can result in the person going into coma. We're not going to go into all the loci, but if you remember, you had some assignment here about this guy here, the locus coeruleus, but you can see there are so many other loci in the midbrain, and they are involved in the reticular activation system one way or another. Gonna skip through this because it's now we're drifting away from the sleep and sleep disorders, but it's just a reminder for the reticular formation and the importance of the reticular formation and the reticular activation system. The same thing here with this slide. I just want you to remember that there is a very close association between the reticular activation system or reticular formation and the awake status or sleep status of yourself. There are several neurotransmitters, and we know that histamine, for example, is a waking signal. We know when you're taking antihistaminics that can put you to sleep, or at least make you drowsy when you're taking a histamine. And GABA, on the other hand, is inhibitory, and some of the sleeping pills will act like GABA. We also know that alcohol acts like GABA, and or a GABA mimic, and therefore you feel like sleepy when you have had a couple of drinks. And so GABA is the inhibitory signal, and there is a lot of loci or centers in the reticular activation system that relies on GABA. Histamine and other things like adrenaline, noradrenaline, all of these are activating rather, not suppressing stimuli. Why do we take coffee? Because adenosine is, believe it or not, it will tell your brain that you're fatigued because you have consumed so much ATP, and now you are releasing adenosine. So that's a fatigue signal, and that's why we feel tired after you run, in addition to the serotonin, in addition to other signals that will tell you your brain. Lactic acid also will tell your brain you're tired. But the presence of adenosine will give your brain the sensation that you're tired. And if you look at the structure of adenosine and caffeine, caffeine resembles a lot adenosine, and it can bind to the same receptor and inhibit it. And therefore, it's not like it's gonna make you feel better or stronger. It will just make you feel less tired. That's the idea of taking caffeine, is it makes you less tired or feel less tired, but it doesn't have any restorative effect. It's just, it binds to the receptor and inhibits it. So that's how it works. There are certain sleep disorders, either that you are not getting enough sleep. We talked about old age, but if in younger people, or if it's a person cannot go to bed easily, can start the sleep or sleep at night, sometimes suddenly, with what we call sleep apnea, for the lack of oxygen, which can be a problem centrally, or preferably that means something is obstructing the air passage tongue or obesity. Central would mean something in the heart or the lung or the central nervous system are affected, and you wake up in the middle of the night and now you're hungry for air. That's what sleep apnea is. Now, narcolepsy is you're completely awake and suddenly you fall asleep. And they tried some experiments on dogs, and they realized that the lack of hypocretin or orexin can result in narcolepsy. And of course, you can imagine driving a car can be very dangerous. Interestingly, orexin now is being targeted by new drugs, because orexin is also an appetite inducer, as we will study when we get to the control of the appetite. And so there are drugs now that are commercialized to inhibit the orexin, and therefore you will eat less. But surprise, surprise, orexin is also needed to stay awake. And they give you on the fine label that be careful when you're using this, you may fall asleep and stuff, because of course you're suppressing something that is very important for staying awake. And as you can see, its absence can result in narcolepsy. What causes it? It's possibly autoimmune disease or other damage in the cells that will produce the orexin, also known as hypocretin. So insomnia is a sleep onset delay. It can be for thousands of reasons. You can't clear up your mind, you're angry, you're in pain, you changed environment, you changed the time zone. All of these things can result in temporary or very long insomnia. There is also something called restless leg syndrome, where generally there is iron deficiency or problem with the kidney, and or certain drugs, and that will cause the legs to twitch a lot. So the person is not really able to fall asleep. The legs are twitching, and that bothers, of course, because you would like to sleep, but your leg doesn't want to sleep with you. And so that's what we call restless leg syndrome, and that will result also in insomnia or waking up in the morning and you're really fatigued. Abnormal sleep, it can happen during the rapid eye movement, can happen during the non-rapid eye movement. Non-rapid eye movements, particularly in kids, they will wake up in terror, they will scream their lungs out, but they don't know what is it. They don't know what they were dreaming. Yes, it's just a very bizarre things that happen in the non-rapid eye movement. Sleepwalking, which is very rare, but it has been now heightened in movies and stuff. A person would wake up and go kill someone and come back and say, hey, I was sleepwalking. But it has been identified that people will step out of bed and just take a couple of steps out before realizing, wait a second, what am I doing here? And some people, of course, can use this as an excuse to break their diet and go to the fridge and eat what they want. I'm not sure if that qualifies as sleepwalking. Disorders during rapid eye movement. There is something called rapid eye movement sleep behavior disorder, in which you will start to act your dream. Remember, I told you that during the rapid eye movement you have inhibition of your motor functions, and almost paralysis of the motor functions. And in this behavioral disorder, you will start to act your dreams. You will jump out of the window, you can smash into the wall, or you can smash into the windows, or do something stupid that you just dreamed of because you were trying to run off danger, and that's, of course, is a problem. Also, exaggeration of the thoughts, exaggeration of the nightmares, and things that keep repeating themselves over and over and over, that also can be a disorder. So I think this summarizes the chapter, sleep, the different stages of sleep, and different stages of sleep, and the sleep disorders, and the certain things that I would like you to remember before getting into the exam. So I hope this helps in your final review, and good luck, and email me or message me if there is any problem. Have a good day.